When we were observing in the outpatient clinics, I found it particularly useful having someone who had no clinical expertise, and in particular someone who was looking at what we were observing through the lens that we were meant to be observing with, and that's the health literacy lens. My journey was learning to have that lens because I look at things as an experienced nurse with clinical lens, and the project is around health literacy, not around clinical expertise. So the conversations that we had afterwards when we debriefed about what we saw, I learnt about a whole lot of interactions that I knew were there. I recognised them when I heard them, but I didn't see at the time because I was picking up more process detail. And hearing the conversations that were being had, and then having the story reiterated back when, from a clinical perspective, it was very expert and it was really well done, but also not noticing that there were things that the mother hadn't picked up on that were not properly clarified when it was explained, or when there was a question asked and it was a yes-no type response, and that would often be the default.
Well, first of all, I was a little anxious about having an observer in the clinical environment. I felt that there were great advantages in videoing the interaction. All the participants hopefully would act a lot more naturally. So we set up a video camera in here, and that avoided that foreign person in the room at the time. The other advantage is that a video could be used as a training tool later, and would have great deal of value in this context. The whole staff embraced the involvement, and it generated a lot of discussion and some changes in protocols as a result. Also, part of this process, we've decided to implement a follow-up communication with 18-year-olds as they come out of state-funded dentistry, because there's far too great a drop-off, and too many of them are never seen again until they're driven there by pain.
The clinical observation for me was a challenge. Being a clinician was to actually be an observer and not get engaged into the clinical content of the consultation, but to watch, listen and record what was actually happening in the environment around, and also watch the body language of the person in the consultation and the body language of the healthcare professional too.